Imagine cutting your own abdomen open with no proper anesthesia, no assistance, and no room for error. This is Dr. Leonid Rogozov performed the unbelievable surgery on himself, redefining medical history forever. Now, picture this: you are stranded alone on the edge of the world in the most isolated frozen landscape on Earth. It's 1961 and you are on a Soviet research station in Antarctica, a place where nothing grows, and the only living creatures around are the howling wind and the occasional thunder. Now imagine that in this unforgiving wilderness you are struck with an illness, you need an urgent surgery or you are going to die. But there is only one problem. You are the only doctor on this. This was the chilling reality facing Dr. Leonid Rogozov, just 27-year-old. Rogozov was stationed in Antarctica, a place far from family, friends, and most importantly, far from any hospital. His job was to look after the health of a small team of Soviet scientists and researchers. But in Antarctica, with temperatures plunging below minus 50 degrees Celsius, even something as simple as a toothache could be a real threat. And suddenly, he was struck by something powerful. One evening, Rogozov felt a stabbing pain in his abdomen, intense and sharp, unlike anything he had ever felt before. At first, he hoped it could pass, but hour by hour, the pain was spreading like fire throughout his body. Soon, he couldn't eat, couldn't sleep, could barely even stand. And as the fever took over, he felt a gut-wrenching realization. This was appendicitis, and it was only a matter of time before his appendix could burst, flooding his abdomen with deadly bacteria. In the outside world, appendicitis is bad news, but in the middle of nowhere, Antarctica, appendicitis is a death sentence. Rogozov knew that if his appendix ruptured, the infection could kill him in days, if not hours. His only hope was surgery, but there is one problem. He was the only doctor within the thousands of miles. Imagine that moment, lying in pain, feverish, delirious, knowing that your life hangs on a single impossible decision. You need to perform a surgery on yourself or you are going to die. Can you feel that knot in your stomach, that creeping dread? Rogozov felt it too, but there was no going back. Rogozov wasted no time. He transformed his small room in the research station into an operating theater, a bizarre blend of desperation and precision. His colleagues gathered around, hands trembling as they prepared to assist him. Their faces fell with fear. None of them had any medical training, yet here they are, ready to help with a surgery that most doctors could dare not to attempt on someone else, yet alone their own body. He instructed his assistants on each tool they could need to pass to him: a scalpel, clamps, a mirror for him to see his abdomen, and a bottle of local anesthetic. He knew that he had to stay conscious the entire time. This wasn't just like some Hollywood movies. He was going to feel every single cut. Finally, the moment came. Rogozov lay back, took a deep breath, and steadied his hand. In the stillness of that room, surrounded by the icy silence of Antarctica, he pressed the scalpel against his own skin. The pain was intense and sharp, a searing white-hot agony that tore through him. But he knew that there was no going back. With every slide, he fought through the pain, cutting through layers of muscles and tissues, inching closer to the inflamed appendix. The room was silent, except for his labored breathing, the only sound punctuating the eerie quiet. The mirrors he had set up were foggy from his breath, distorting his view. And every time he looked down, he saw himself in reverse. His own body looked foreign, alien. As he went deeper, Rogozov's vision began to blur. He started feeling lightheaded, his body begging him to stop, but he forced himself to keep going. If he lost his nerve now, if he blacked out, he could die right there on his operation table. His assistants watched in horror, afraid to make a sound, terrified that a single distraction could lead to a disaster. Minutes stretched into what felt like hours. The pain was like nothing he had ever imagined. His own heart pounding in his ears, his body trembling as he fought against himself to finish the procedure. And then finally, he saw it. The appendix inflamed and swollen, a ticking time bomb just waiting to burst. His hands leaked with sweat, carefully moved the clamps around it. One wrong move, one moment of hesitation, and he could rupture it. Finally, Rogozov isolated the appendix, carefully removing it with every ounce of strength he had left. His vision was fading, his hands were numb, But he forced himself to push through, stitches by stitches, until he had closed the incision. He had done it against all the odds. He has cut into his own body, removed his own appendix, and stitches himself back. Wow, what a charm! He lay back, his body spent, his mind ridden. He had survived in one of the most remote places on Earth, facing the most impossible. Dr. Rogozov has saved his own life. Rogozov's self-surgery was one of the greatest feats of survival in medical history. In Antarctica's unyielding cold, in the face of unimaginable pain, he had performed an operation that could terrify even the most seasoned surgeon. But his skill, courage, and will to live carried him through. This isn't just a story of survival, it's a story of what we can do when every single odd is stacked against us. Dr. Leonid Rogozov didn't just save himself, he proved the limits of human endurance are far beyond what most of us could ever imagine. In the face of death, with nothing but his own hands, he achieved the impossible. Curious fam, if you find the story as thought-provoking as we did, smash the like button, hit subscribe, and join us as we continue to explore the unbelievable wonders around the world. Be curious, stay curious for the journey ahead. See you guys in the next video.